Good evening, everyone, and welcome to our Cecelia Health webinar, Blood Sugar Boot Camp. So we'll be learning all about the ins and outs of blood sugar testing this evening. We've got a really fabulous presenter coming up, so um, we're all happy that you're here. So should you have any technical difficulties during the broadcast, there's a number at the bottom of the screen to call Log Me in Support. The number is 1-800-263-6317. Um, and there is a webinar ID at the bottom of the screen as well that you can take down just in case you have technical difficulties. So our format includes a short presentation followed by an interactive discussion. To type in a question, you use the question section of the webinar toolbar, which you'll see at the right-hand side of your screen. At the end, you'll have a chance to ask questions, and we look forward to an interactive webinar. We know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice only. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecelia Health Certified Diabetes Care and Education Specialist. Our speaker this evening is Laura Eston. Laura graduated from St. Joseph College in West Hartford, Connecticut in 1982 and is a professional nutritionist and diabetes educator who specializes in diabetes self-management and medical nutrition therapy. She's committed to forming relationships with people seeking a new approach to optimal wellness through a mindful awareness. She uses motivational techniques that are individualized to empower her clients to make gradual, successful, and life-enhancing health challenges. Laura is very active, volunteering her dietitian services in her local community and facilitates a diabetes support group through her local senior center. In her spare time, Laura can be found out in the garden or on the beach, unless, of course, she's with her grandchild. Laura loves yoga, quilting, and converting her family's traditional recipes into healthier versions that are still full of flavor. So thank you so much, Laura, for being with us this evening, and you may take it away.
Thanks so much, and good evening, everyone. So tonight we're going to talk about why we should check our blood sugar, the benefits of what we call self-monitoring blood glucose, or SMBG, when we should check and how to check, keeping a log, which is always helpful, target ranges, like what should my blood sugar be at the time of day that we're checking it, and how to manage the numbers that aren't in the target range, those highs and lows. We're going to talk about something called dawn phenomenon. Also going to talk about ketoacidosis and checking for ketones. These are two things you may not have heard your doctor talk to you about, or your health coach. So feel free to type questions in the chat, particularly about these things, which may be totally new to you. Also going to talk about our A1C numbers and how to interpret what that number means, as well as estimated average glucose, or EAG. And then, of course, at the end, we'll have questions and answers and sharing. And just a reminder again, please talk with your healthcare provider before making any changes to your diabetes treatment plan. So the benefits of checking your blood sugar are many and individualized as well, but it gives us a good picture of our body's response to our diabetes care plan. It tells us if we're keeping our blood sugar in range, and that can prevent or delay complications. That's really important. We can see how our blood sugar rises and falls throughout the day, which is normal, whether we have diabetes or not. We'll find out why we should take steps to keep that blood sugar in range, and especially important for monitoring regularly if we're taking insulin, if we're having a hard time controlling our blood sugar levels, if we're having low blood sugars without the usual warning signs, especially, and we'll talk more about that, and if we have ketones from high blood sugar levels. So these are items that may increase our blood sugar when we're checking our numbers. So many people tell me they're afraid to check their blood sugar because they know it's going to be high and they don't know what to do and it stresses them out, right? So these are reasons that our blood sugar might be running higher than we would expect it to be. Physical inactivity, but sometimes when we've exercised, it can be a higher number. And that's especially if we've checked our blood sugar like right after exercising, okay? That's a metabolic response that occurs in our body in response to the exercise, okay? Stress can increase our blood sugars big time, especially if it's really intense stress. When we're sick or ill, our blood sugars will often go up. Of course, that all too familiar high carb meal. That's usually the number one cause for a higher blood sugar, but not always. And not having enough diabetes medication. So, especially for people who are working with a health coach regularly, oftentimes that's a big part of what we help you to troubleshoot. Whether or not your current medication is doing the job efficiently, or whether you need to talk to your doctor about an adjustment in your medication. So these are items that could lower your blood sugar. Missing a meal or snack, not having enough carbs at your meal, and alcohol intake, especially on an empty stomach. So the alcohol intake concern is actually a delayed response that occurs. And, and unfortunately, oftentimes when we're having a cocktail or we're out socializing, we come home, we go to sleep, and the low blood sugar that occurs from a high alcohol intake, especially on an empty stomach, tends to happen about 6 hours after consuming that alcohol. And so a lot of times it's when we're sleeping. So especially if we have more than 2 ounces of alcohol, it's very important to eat something when we have alcohol of any type and to try to limit it to 2 ounces of alcohol at a time. How and when should we check our blood sugar? So first of all, how? The first and most important thing is you want to wash your hands before testing. If you've been checking blood sugars for a long time, you may remember when we used to tell you to clean your finger with an alcohol swab. And you might still be getting the alcohol swabs when you go to pick up your test strips. It's actually been found that that is very drying to our fingers and that washing our hands with soap and water before we test is adequate to clean the skin and get rid of the bacteria. You want to insert a test strip into your device, and you want to use that lancing device to test on the side of your finger. So you see in the picture where he's not putting the lancet device on the pad of the finger, he's putting it on the side. That helps to minimize the pain and the sensitivity that can occur from especially repeated blood sugar monitoring. The pads of our fingers are some of the most sensitive parts of our body because that's what we use to feel things. So always try to test on the side there, okay? You want to touch and hold the strip to the drop of blood, and your blood sugar level should appear in the meter's display. If you get an error message, one of the most common things that occurs is, especially if you haven't used your glucometer in a while, the battery may be dying. And we do actually encourage you to replace your glucometer every 3 to 5 years. They aren't the most elaborate or advanced little devices, and it's actually better to just get a new device than to try and find the battery to replace one that you've had for a while. So when should we check our blood sugar? The fasting blood sugar check in the morning is oftentimes the one that your doctor is most interested in or feels is the most important, and oftentimes that's the one they'll tell you to check. And that would be in the morning, unless if you have a a night schedule, and you sleep at a different time, it would technically be upon waking after your biggest chunk of sleep. This is a common question that comes up. But it is usually in the AM before you eat your breakfast, and ideally as soon after waking up as possible. So if you're the kind of person who wakes up and sort of, muddles around the house, or, makes the coffee, waters the plants, checks on this, that, or the, checks your email or whatever, and you don't eat breakfast for an hour or so after you're walking around the house, it's better that you check your blood sugar as soon after waking than to wait until the actual meal right before your breakfast. The only time that it's important to check right before the meal is when you're using rapid acting mealtime insulin. Then you would actually want to wait until right before the meal. So before the meal, or what we call pre-meal, and 2 hours after the start of your meal, that's a really helpful time. So before meals, most of the time is used by people who are using mealtime, rapid acting mealtime insulin. And the 2 hour after the start of a meal check is really useful time if you're trying to identify whether you're eating too many carbs, if that's what's causing your high blood sugars. Then a 1.5 to 2 hour after meal blood sugar check is really, really useful. It really will open your eyes as to whether your body can handle the amount of carbohydrate that you're routinely eating at your meals. Okay, but 2 hours after the meal is really hard to remember. So what I suggest to my clients and my coaching people is when you start your meal, sit down to your meal. Most of us now have a smartphone, or we have a microwave, or even a regular oven with a timer, and set the 2 hour timer when you sit down to your meal. And that way, if you get involved after the meal, the timer will go off. And if it's convenient for you, then that's a good time for you to check your blood sugar. If not, then at the next meal, try again. Checking your blood sugar 2 hours after breakfast, lunch, or dinner is always a useful time. Checking before bedtime is also very helpful, particularly if you're if you suspect that you have dawn phenomenon, which we're going to talk about in a couple of slides. So if you check before you go to bed, and then you check again as soon as you wake up the next morning, don't be surprised if your bedtime blood sugar is actually lower than your fasting blood sugar in the morning. That's where we're going to talk about this dawn phenomenon. That's what explains that. And then, most importantly, ask your primary care doctor or health care provider, that's what HCP stands for, when and how often it's best for you to check your blood sugars. Okay? So keeping a log can be really, really helpful. And everybody has a different way of keeping their log. Back in the day, we'd get these log books that would come with our glucometers, and a lot of people really liked that approach, and they don't actually give out the log books as much anymore. So you can actually download from the computer. Diabetes.org is a great resource for something like this. A printed sheet for blood sugar monitoring and keeping your records, or you can just use like a little notebook, like a composition book. I encourage that because you can also write other things in there really easily. You want to record the date and the time that you're checking your blood sugar. That's real important. What the blood sugar result was, and then any notes like what kind of a meal it was, if you had a lot of carbs, if you had some sweet items, because when you go back and you're troubleshooting, those notes really make a big difference. It helps sort of jog your memory as to why that particular number may have been too high or too low. Amount of exercise that you may have done before that blood sugar monitoring check, and also how you're feeling, particularly if you're stressed or you're feeling shaky or you're really, really tired. But any sort of awareness or mindfulness of how you're feeling at that time when you check your blood sugar. Some smartphone apps have become really popular for monitoring blood sugar. And again, a lot of monitors, now have the fancy computer chip, and you can pull up your 7-day average, you can pull up your 2-week average, 3-month average. You can scroll back and look at your numbers, and you can put notes in the monitor, but that's kind of hard, and it's very hard to see, especially when you're troubleshooting. So having your numbers written in a booklet, or in a format where you can look at it in a smartphone app really gives you the benefit of being able to do more troubleshooting to identify some areas where you might want to focus, or look at your meals, or look at what's affecting your blood sugar numbers. So these are just some smartphone apps to check out. So let's talk about where that number should be, okay? The American Diabetes Association recommends that when we're checking our blood sugar right before a meal, which is referred to as preprandial, it should be between 70 and 130. Now, a lot of people tell me that when their blood sugar is in the 70s, they feel shaky. They feel like they're having a low blood sugar episode, or that they're going to. And and that's the mind and the body's way of telling you, hey, let's eat a meal, otherwise it's going to drop below 70, which is technically considered a low blood sugar. 2 hours after beginning your meal, which is called postprandial, you're in good shape, you're in a good place if it's less than 180. And target range for our A1C is to be 7% or less. So a lot of people don't actually know what their A1C is, and this is something I really encourage everyone to know, because our our fasting blood sugars in the morning, we could be checking the fasting. Maybe that's all the doctor ever asked us to do. And we check our fasting blood sugars in the morning, and they're like 110, 115. We got great numbers. And so that's it. We don't worry about it. We go about the rest of our day. And then we go to the doctor and we get an A1C, and the A1C is 7.2, greater than the goal range. And the doctor says, this is not good. Your risk of complications is greater when your A1C is greater than 7. You need to get this down. And you say, but doc, my numbers when I check in the morning they're looking great. We're going to talk about um, how it's very possible and common, actually, to have good fasting blood sugars in the morning, but that your blood sugar's going up later in the day, when after you eat a meal, and staying too high 2 hours after the meal. And that's what's driving your A1C up. So you may have different ranges that your doctors told you. Maybe your doctors told you that as long as your blood sugar is less than 150, you're doing fine. Or maybe they've said less than 180. 180 used to be the goal range quite a few years ago, and the reason that we've lowered it is because we found that being okay with less than 180 in most people means that their A1C and their risk of complications is greater. So the doctor individualizes the goal range for you based on the duration of your diabetes, or like how many years have you had it? If you've had diabetes for 30 years, your doctor may feel, it's okay for you to have your blood sugar in a higher range. Your age, and then other medical conditions, the complexity of your health status is a big factor in having a realistic goal for your blood sugars, okay? Particularly if you have CVD, which stands for cardiovascular disease, or advanced microvascular conditions. And that's a really technical way of saying that the little tiny blood vessels in your body, possibly behind your eyes, or in your kidneys, or in your feet or your hands, that those little tiny blood vessels are suffering, that they're damaged from long-term effects of high blood sugars. And so the doctor may feel that a little bit higher blood sugar may be completely fine for you, okay? Hypoglycemic unawareness is when a person has no way of knowing that they're having a low blood sugar episode. And so for most of us, we really feel it. You might get shaky, have blurry vision, cold sweats. Everybody's symptoms of a low blood sugar can be a little different. Some people get a little bit of chest pain or anxiety. Some people tell me that they just feel like something's wrong, and then they check their blood sugar and they see it's like 68 or something. So when a person has hypoglycemic unawareness, the central nervous system in their body has suffered some damage. Could be from a number of things, one of them being long-term high blood sugars. And so the brain's message to the body to tell you that the blood sugar is dropping to an unsafe level is impaired. It's not able to, the brain's not able to get the message through. And so the person can't tell that they're not having any symptoms that tell them that something's wrong. And this can be a really dangerous situation. And so for those reasons, the doctors will definitely, adjust the acceptable range for you so that you don't drop too low ever, so that you don't put yourself in that risk. And then, of course, individual patient considerations. Oftentimes, people are on medications that can interfere with reaching blood sugar goals, typical blood sugar goals. And oftentimes that's temporary. That's one example. People who are receiving chemotherapy or radiation oftentimes have a different blood sugar goal range as well. Those are just some examples of that. Don't forget to write your questions down as we go through all of this, so that or you feel free to type them in the message box when you think of them, and then we'll address them when we come to the end. Okay. So postprandial glucose. Remember, I said that that your between meal blood sugars may be interfering with having an A1C that looks good, that's less than 7, and your fasting blood sugars may be perfectly fine. So that's why those between meal blood sugar checks can be really, really helpful. I encourage them all the time. So hypoglycemia and hyperglycemia, these are medical terms for hypo being low blood sugar and hyper being high blood sugar. So hypo or low blood sugar is when we have too much insulin in our system or we don't have enough food in our system. And the causes are commonly not eating enough carbs at our meal, taking more insulin than is needed, particularly when we're using rapid-acting mealtime insulin. Maybe we thought we were going to be eating more carbohydrate foods than we actually did. That can result in a low blood sugar. And exercise. Exercise can really drive that blood sugar down. And so, especially when someone starts a new exercise regimen, or like every spring when everybody, is dusting off the cobwebs of hibernation during the winter and starting to be more physically active, I always warn my coaching participants, this is a really important time to stay aware of the possibility of low blood sugars. When we go and exercise, or walk, even like going to a flea market or something for an hour or two, and we're not normally doing that kind of exercise, it's possible that that can cause a low blood sugar. And again, remember, with exercise, often it's a sort of a delayed low blood sugar. It can happen up to 6 hours afterwards. The symptoms of low blood sugar, most common is the shakiness, sweating, very common, some weakness or feeling like you're going to pass out, a rapid heartbeat. That's that chest anxiety symptom that a lot of people share with me. So what should we do when we feel like we're having a low blood sugar? If you have your glucometer nearby, you should check your blood sugar and see where it's at. And if it's less than 70, that's clinically a low blood sugar, true hypoglycemia based on what the doctors consider. However, it's quite possible to have those symptoms of a low blood sugar when you're in the 90s, for instance. And for some people whose blood sugars have been running really high, like in the high 200s or 300s for a while, and they're doing some great work to get their numbers down, if we bring the numbers down too quickly, oftentimes the brain revolts and will send messages of having a low blood sugar. But when we check our blood sugar, it's like 115, which is in the goal range, which can be very confusing for people. So if you're having those symptoms of shakiness, sweating, weakness, rapid heartbeat, whatever your body's message is, you should always address that and treat it with the rule of 15, but be very limiting in how much carb you take in and make sure you recheck your blood sugar. So the rule of 15 is that you take about 15 to 20 grams of fast acting carbohydrate. So an example of that would be half a cup of juice or a full 8-ounce cup of milk. Or if you use glucose tabs, you can get these little glucose tabs sort of look like Tic Tacs at the pharmacy. And depending on the brand, usually you take 3 or 4 of those little tablets. That would be a 15 to 20 gram portion. Or in a pinch, you could use something like a hard candy. A lot of people will keep a hard candy in their car, a couple of them. You want to look at the size of it. Usually 2 peppermints is what I recommend, those red and white ones that come in a cellophane. You don't have to worry about them melting. You don't want to use chocolate. So this isn't a good reason to have that chocolate bar that you're craving. Chocolate is actually a very complex food, and it takes a really long time for our body to break it down and digest it, and for the sugar that's in there to get into our bloodstream. And by the time that happens, our blood sugar could really plummet down into the 30s or 40s and put us at danger of passing out. So we don't want to use chocolate of any type. Okay. If you're really in a pinch, you could use like a tablespoon of maple syrup if you really needed to. Most importantly, 15 minutes after giving yourself this 15-gram portion of fast acting carbohydrate, you want to check your blood sugar again. And that 15 grams should be enough to bring your blood sugar up at least 50 points. You want to be at least in the 100 to 130 range. And if you're not, and you're still having symptoms and your blood sugar is still down there in the 70s or less, you would want to take another 15 grams of a fast acting carbohydrate. But if your blood sugar did come up nicely, then you want to really go ahead and have a complex carb, ideally like a half a sandwich, or have your meal, have some protein as well as a carbohydrate. Um, and that way your blood sugar will stay up and not drop back down too quickly. If you find that you're having low blood sugars frequently, that's a really important thing to troubleshoot with your health coach and bring to your doctor's attention, okay? Now let's talk about hyperglycemia or high blood sugar. So this occurs when we don't have enough insulin in our bloodstream, or when we have enough insulin, but it's not doing the job right. It's not getting the job done and helping to get the glucose that's in our bloodstream into our cells to be used for energy. Causes of high blood sugar, stress is a biggie. And when we're sick, when you're ill or you have an infection, this is a very common cause for high blood sugar. If you ate too many carbs at your meal, of course, especially concentrated sweets, and if you're not exercising, these are all things that can contribute to high blood sugars. The most common sign of a high blood sugar is increased urination and thirst, although a lot of people say that they get a headache or blurry vision. And the problem with that is those can also be symptoms of low blood sugar. So best thing to do when you suspect you have a high blood sugar or a low blood sugar, check your blood sugar level with your glucometer and find out just where you are. So treatment of a high blood sugar, ultimately you want to change your meal plan. You want to talk to the doctor about possibly changing your medication. In the meantime, you want to drink lots and lots of water. That's the most important thing you can do in the moment, okay, is to just drink as much water as you possibly can. Sometimes the cause of a high blood sugar is that we're just dehydrated. We're not drinking enough. And we can flood our system with some extra water, and that can literally dilute our bloodstream a little bit and help bring that blood sugar down. Or we can do some physical activity. But you do want to be very careful with doing some physical activity, particularly strength training or muscle-related exercise will help bring that high blood sugar down really nicely. But if your high blood sugar is up over 240, then you really don't want to use physical activity as a way of bringing a high blood sugar down because you may be dizzy or lightheaded, and you could increase your chance of falling or hurting yourself. So be cautious with the physical activity aspect for lowering blood sugars. Okay. So let's talk about this ketoacidosis and checking for ketones. This is something that we used to do. I'm giving my age away here years ago when I first became a dietitian. And we don't seem to have that many people who know about it or whose doctors have recommended it. So I always encourage people to ask your doctor about checking for ketones. So ketoacidosis is a metabolic condition where when the body doesn't have enough insulin and it can't get the glucose into the cells to be used for energy, the blood sugar goes really high and it stays really high. Okay, it stays up there. And so the body has to break down fats to use for energy. And in doing that, the fats that are in our on our hips and stored in our tissues, they have a waste product when they're broken down to be used for energy called ketones. Now, a small amount of ketones in our bloodstream is manageable and tolerable for our body. But when there's a large amount of ketones in our bloodstream, it's a toxic buildup and it can be very dangerous. Our body gets rid of those ketones through our urine, through the kidneys, pulls them out of the bloodstream as much as it can, puts it into the urine to be removed from the body. So that's where checking for ketones comes in. Okay, so these are keto sticks, and if anybody's ever had a parent or a grandparent who had diabetes, these may look similar to the actual blood sugar sticks we used to use as well. But keto sticks are specifically for checking for the presence of ketones in the urine. And you can see that color scale on the side there. That's what you would compare the color of your little stick to. So you want to check ketones if your blood sugar is running more than 300, if you're feeling nauseated, you have vomiting or abdominal pain, if you've been sick with a cold or a flu, even if your blood sugar's normal, okay? And that's a metabolic sort of a thing that happens. If you're feeling tired all the time, if you're really thirsty, no matter how much water you drink, you're still thirsty, or you have a very dry mouth, if your skin is flushed, or if you're having a hard time breathing, particularly if your breath smells fruity, or if your brain's really confused or you feel like you're in a fog. Those are all good reasons to check for ketones. Talk to your doctor about that. I believe you do not need a prescription to purchase keto sticks nowadays, but that's a good question for your pharmacist. Most places, I think you can buy them over the counter, but you want to check with your doctor first. So now let's talk about that dawn phenomenon that I was referring to. So everybody, whether they have diabetes or not, experiences dawn phenomenon to some degree. The researchers tell us that this is an ancient mechanism left over from the days when we were hunter-gatherers and we were sleeping in caves and we had to wake up in the morning and go out and hunt for our food. We had to have energy to do that. Our brain had to be able to function to go out and hunt for food or pick the berries or whatever it was we were looking for. And so in the wee hours of the morning, around 4 or 5 a.m., hormones surge through our body and result in a release of sugar, glucose, that's stored in our liver. So people with diabetes don't have a normal insulin response to compensate for this. And so they may actually see a fasting blood sugar in the morning that's really high. And sometimes this happens like only every once in a while, which can make it even more confusing. For other people, it happens all the time. So some steps that can help is you want to make sure you're eating dinner earlier in the evening. You want to try and control or reduce the amount of carbohydrate at that evening meal. This is a really big challenge and sort of a leftover practice for a lot of us is that we eat our largest meal in the evening. it's really better for our body if we don't have a largest meal, or if we are going to have a largest meal, that it be the one in the middle of the day, especially when we have blood sugar issues. And if we go for a walk after having our dinner or do some physical activity after having our dinner, that can help control the dawn phenomenon spike. Or if your fasting blood sugar continues to be high, you want to bring it up to your healthcare provider, who may need to adjust your medication itself, the dosing, or sometimes the timing or the time of day that you're taking your medication can help with controlling dawn phenomenon. So that's where, remember I was talking about checking your blood sugar before you go to bed at night and then checking it again as soon after waking as possible. Those blood sugar checks together will tell you whether you're experiencing dawn phenomenon. Okay. All right, now let's talk about A1C and estimated average glucose. So this gives you a picture of what your average blood glucose or blood sugar control or levels been for about a 3-month period of time. And it's 24 hours a day, 7 days a week for a 3-month period of time. So if you're only checking blood sugars once in a while or just in the morning, you really need to find out what your A1C is and know how it shifts each time it's updated, because this is a really good indicator for you of whether you're on the right path or if something's changing in your lifestyle practices or in your body, which can happen. It's not always what we were eating or whether we were or weren't exercising. Those are the most important things, but sometimes it's changes that occur in our body that can cause shifts or increases in our average glucose readings or our A1C. And so staying on top of that number can be real helpful. The blood glucose monitoring that we do with a little glucometer, that checks your blood glucose for just one moment in time. It's just a little snapshot. This gives you the big picture, okay? And it tells you a lot about how your diabetes self-management is working, whether or not the plan that you and the doctor, the treatment plan that you and the doctor have come up with, if it's working for you. And if that number's not where it needs to be, then that means it's time to talk to the doctor about what needs to shift or change, okay? A single day's blood test never gives you the big picture, okay, like that fasting one. And this actually is used to help confirm what your self-testing results are. And also shows how healthy choices can make a huge difference in your diabetes control. There are some rare or unusual circumstances where the A1C would not necessarily be an accurate reflection of blood sugar monitoring, but that is very rare condition, generally associated with a certain type of anemia or certain types of severe kidney disease. So in situations like that, if your A1C is not lining up with your blood sugar monitoring and you're doing blood sugar checks, throughout your day, then it's important to bring your records and show your doctor that these are the numbers that you're getting, and you and your doctor can do some troubleshooting around that. So this chart is really handy because it tells you what the average blood sugar number is that's associated with a particular A1C. So a lot of times I'll be coaching with someone whose blood sugars are running in the 150s or the 160s, and they'll feel that that's fine, but they'll say to me, but my doctor told me I have to get my A1C down to less than 7. So this is where I help them understand that if you're seeing numbers like 150s and 160s, chances are pretty good your A1C is going to be greater than 7 when you go back to the doctor next time. So you really want to shoot for that 140 range or less than 150, and ideally 130s or less. 130 to 140 is a really safe place to be. So this is the time to ask questions. If you have a question that's not been answered during the webinar, please feel free to type your question in. I don't see any questions yet, I'm hoping that means I did a really good job of anticipating your questions. A lot of the things that I explained a little deeper for you are things that my coaching participants commonly ask me. Okay, but one thing whenever we're talking about blood sugars that invariably comes up with our coaching participants is um, blood sugar monitors and questions about commercials, that you may have seen about those fancy new blood sugar monitors where you don't have to poke your finger. So one of the most common ones is called the Freestyle Libre. Now, these types of glucose monitors are called CGMs or continuous glucose monitors because they have a little sensor that is inserted into your skin, and you can't feel it when it's in, and you barely feel it when it goes in. The device that injects it and attaches it to your arm uh, is probably more startling than the little sensation of the sensor device going in. Speaking from experience here, and these Freestyle Libre devices are extremely helpful when people are running higher numbers and they just don't feel like they can figure out why. The challenge or the problem is that most insurance right now will only cover a Freestyle Libre if the person is using two types of insulin, so rapid acting mealtime insulin, as well as a basal insulin or long acting insulin. Those are the ones that are given at night usually or once a day. So if you're using both of those types of insulin and you're interested in getting a Freestyle Libre or another type of continuous glucose monitor like the Dexcom G6 is another popular one. Um, and so I just lost my train of thought because I'm looking at the question, wouldn't that be a false average? I'll come back to that. So sorry. So if you are interested in getting a device like this and you're not using two types of insulin, you can talk with your doctor about ordering one. You can call your member services on the back of your membership card for your health plan and talk to them about the coverage and the qualifying conditions. And then you'll be able to have a more informed conversation with your doctor. Many people will choose to purchase a Freestyle Libre out of their own pocket and use it only for a couple of months to really help them get a grip uh, on where they're eating too much carbs or what's going wrong with their blood sugars. So the question that's here says, wouldn't that be a false average? Um, I'm. Let me see if I can. Okay, it's really hard for me to see it, so I'm just trying to read the entire thing here. So this question is, hello, I use an app to track my glucose, medication, and food. That's awesome. How do I know the average is correct? It is only averaging what I think. So if I test when I know it's lower, then wouldn't that be a false average? That's really wise of you. Yes. So um, it it can be misleading. Not so much a false average, but you're on the right track. Um, it would be a misleading average. It wouldn't be a truly accurate one. And this is something that can be really hard, right? To check our blood sugar after we've eaten a meal where we know we ate a little more carbs than we would normally. So one of the most beneficial times to check our blood sugar, every once in a while is after a meal where we've had a larger amount of carbohydrate, because that's really going to give us some useful information on whether or not our medication and our lifestyle practices are syncing so that within 2 hours that blood sugar is dropping back down to where the safe range would be. I hope that answers your question. If it doesn't, please type another question in and ask me to explain more if there's something else that you want me to go into. But that was a great question. So yes, the using an app to track your glucose definitely is dependent on randomly checking your blood sugars throughout the day at times when you know that it's going to be higher than at other times. That's going to give you the most accurate indication of where your A1C will probably fall when you go into the doctor's office next time. So I hope that helps. Any other questions? Okay. Well, another question that I get a lot is people will say, is it really necessary for me to check my blood sugar? My doctor says that I, have borderline diabetes or pre-diabetes, right? Or the doctor hasn't even prescribed a glucometer, which is common for people who are sort of in that gray area. And one of the things I encourage you to do if you don't have a glucometer or your doctor's never encouraged you to check blood sugars is to have that conversation with them. Let them know that you're working with a certified diabetes care and education specialist, and tell them that you would like to monitor your blood sugars, even if it's just for a short period of time, to do some troubleshooting around your lifestyle changes that you're making and whether you're on track. Because those blood sugar checks throughout the day at all the different times are what we call randomly. That is really going to help you key into which meals of your day are not being well processed by your body, which types of foods are not are contributing to the higher blood sugars and not keeping your blood sugar under control or helping you to get that blood sugar down into the safe range after your meal. And see what your doctor thinks. One of the things that can be hard is sometimes people get a little obsessed with their blood sugar monitoring, and that's never a good idea. You don't want to check it too much, and you don't want to be checking it all the time if it stresses you out. So I have had people who, when they check their blood sugar more often, they get anxious about the numbers that they're seeing, and so that's never really a good thing. So you want to talk to your doctor about that as well. Any other questions? Okay, well, I encourage you to, use your resources and talk with your health coach. Consider putting these dates in your calendar for A Happy Heart is a Healthy Heart on September 15th at 6 p.m. and Diabetes 101, Mastering the Essentials on October 19th, also at 6 p.m. Eastern Time. The other thing you may want to do is you can go to the website for registering for the webinars. If you haven't already noticed this, if you scroll down, you'll find a little box to click on where you can watch the past recordings of other topics that we've done, and you can watch them at your leisure. And so the biggest difference being you don't have the benefit of being able to ask questions, but you can most certainly ask your health coach when you talk with them. These are some other resources through Cecelia Health. We have a Facebook group called Diabetes Innovation Hub. And if you search in Facebook for Diabetes Innovation Hub, should bring you right to that diabetes Facebook group. And then we have the Cecelia Health blog at ceciliahealth.com/ENU-US and /blog. Last chance for any other questions. Well, I've really enjoyed sharing this evening with you, and being able to share with you a topic that I'm really passionate about. Blood sugar monitoring can make all the difference in the world. I encourage you to find your comfort level with it. Talk with your doctor about your numbers and when you should test, what they recommend. Use it to troubleshoot and help you get to where you want to be so that you can minimize your risk of complications of type 2 diabetes or type 1 diabetes. And I want to thank you all for sharing your time with me this evening, and I hope to see you again on another webinar in the future. Oh, thank you, Christina, and thank you all so much for being here. Have a wonderful night.